No mask. Why you got a mask on?
Because I don't want to get sick.
But that's not how you get sick. You get sick by touching your face with your hands.
Hey, you can also breathe it in.
No, it don't work like that.
Okay, so that's a clip from earlier this year around May 23rd, actually. And this is at SPI, where this reporter from KRGV, Channel 5 News, it's interviewing this gentleman, and he's got no mask. Everybody's just like chilling at the beach. Anyways, guys, welcome to the Netflix podcast, a podcast from the RGV, and we're here with beautiful Cass.
Hey, guys.
Anyway, so today we're going to talk about coronavirus in the RGV.
Oh, yeah.
We're going to talk about how its impact, and for disclosure here, I know we're going to butcher the timeline a little bit. We are not
professionals,
reporters for any means, or what's the other name for reporters?
Journalists.
We're not journalists. We're not professional journalists by any means, but we're going to do our best here to kind of navigate you guys to like what happened, where we at here in the RGV. So let's start with the first thing first. The first case of COVID-19 in the RGV was in Cameron County on March 19, and it was a travel-related case. At the same, it seems like it was contained, and then spring break came. And as you guys know, you guys just saw the viral video that,
Well, South Padre Island is a huge spring break spot. Everyone goes there. And I understand, like, at the time, it didn't seem as serious. But as we quickly found out, it was a bigger situation that we ever could understand.
Yeah, that's definitely for sure. And a little bit of context here too as well. My line of work, it's focused around, I'm an EMT. So, I'm in the medical field, and we do respond to 911 calls here in the RGV. And Cassie, her line of work includes...
I am a case manager for a state program.
So we are very community-oriented individuals here. So we are always looking out for the community. That's basically what we do. And we did see a lot of areas affected by COVID in my line of work and in her line of work as well.
Oh yeah, that's for sure.
Okay, moving on. So on March 27, and Hidalgo County Judge Richard Cortez ordered a shelter in place.
It's currently still in effect, although our sheriffs, our policemen can't really enforce it just because there's businesses that are still open past, 11?
Correct. And it's very difficult, especially for the RGB. If you look at global economy, at least as far as it goes for our country, the RGB is considered one of the what would you say that, like, low income?
We are very low income. I know that we are in poverty line, and there has been reports over the RGV. I know that, I think it was in Escobares, Texas. They are considered one of the poorest cities.
Cities here in the RGV. Yeah, I mean, it's understandable. The economy here, it's not as big as other cities. We don't have a lot of infrastructure and tech businesses that, you would say attracts a lot of people. What we do have is the border, and I think a lot of our revenue comes from, people come over and vice versa.
Absolutely. And I know that there's people who go over to Mexico and they buy any products, and they'll come over here and they'll sell it for a higher price, obviously.
Yeah, definitely. But in general, just like we have a lot of unemployment here, and so whatnot, and so on and so forth. But yeah, it's been really difficult for everybody here in the RGB with COVID, and the police officers. It's hard for them to enforce, the shelter in place and the lockdown, especially when people are like hard hit. And I understand, like, look, myself and Cassie here, we're tired of the like being a lockdown, we want to do all these things. We had all these plans, like everybody else,
Oh my
to
gosh.
travel.
We had so many plans for 2020 and everything has just been postponed and pushed back. And it's a downer.
It's definitely a
is.
downer, you know. Yeah, no, one of the things that the RGB and it's known for, it's for its culture, for with the shared culture that we have with Mexico, and we have a large population of Hispanics mindset. And that's understandable, you know, because a lot of families come from Mexico or they're rooted in Mexico, and that didn't help the pandemic. If you guys are, I'm sure you guys are listening, you know how every Mexican family is. We're very close together, you know, and the whole pandemic said, wait a minute, you guys can't, you know.
Excuse me. I know that there is a lot of households that have multiple generations in them. They have their grandparents, their parents, ourselves, and, you know, like if we have children, there is about 4 generations in a household here in the RGV, and it is kind of hard because we are very family oriented in our culture, and we just want to be with our family, especially through hard times like this. But in this case particularly, this is where we should be keeping our distance the most, just to protect the vulnerable population.
Yeah, most definitely. So that's basically one of the big things that affected the RGV in that sense, and how it's really hard to enforce that, you know. Okay, so moving on. So May the 1st,
Our governor, Texas, Greg Abbott, he lifted the mandatory stay-at-home lockdown. So in a direct result of that, we had a spike in cases here in the RGV, over 1,000 cases reported on May 14th.
and let's just put that into perspective, because you know, a lot of things that happen, say for example in north of the country, like say New York and all the other places, especially that's where the outbreak started. It kind of trickles down, but it trickles down very slow. It's not like a fast response. It takes days and months for us to catch up to them, because we're so secluded from the large population. Now, this is what happened. New York started with their cases. They hit peak. They went into lockdown, and Texas and the other states follow after, right?
Yes.
But when these guys were in the middle of a pandemic, peak cases, you know, they started working on a plan to control it, and eventually they did. And when their cases started dropping, everybody said, "Oh, you guys are good. I guess all of us are good." And when people heard, okay, that's the end of the lockdown, they heard, "Oh, there's no COVID. There's no more COVID."
It's as if COVID just was like, oh yeah, I'm already on vacation, deuces.
And that's definitely not the case. The disease was moving very slowly.
I believe it was moving slowly just because it took 2 weeks for you to develop symptoms after
That's
you were
correct.
exposed.
So there's an incubation period of 2 weeks. So say, for example, I get infected and I go on about my business. You know, I'm working in EMS, being in contact with this other patient. And let's imagine for a second that I don't wear a mask, right? Say, for example, okay, well, there's no COVID and I'm not wearing a mask and I'm in contact with patients for 2 weeks before I show any signs and symptoms of a fever, chills, a sore throat. In those 14 days, whomever I come in contact with, that whether it's in the hospital setting, whether it's in the public, me going to the store, me interacting with my coworkers, I could have potentially infected a lot of people in those 14 days before I even show symptoms. Of course, it is different for everybody. You know, some people are asymptomatic. And what that means is that they don't show any signs of symptoms. You know, they're infected, but you know, they look perfectly fine.
Right, and they feel perfectly fine. It's just that the virus is active within their immune system.
Correct. And next, guys, we're going to show you a video that went viral here in the RGV, and it's from Dr.
Christian Assad.
And I've seen this doctor. When I saw him, I was like, oh my God, I was fanboying. I saw him in DHR. No,
I know that. I showed him to you because he came up on my TikTok.
Correct. And correction, I didn't see him at DHR. I saw him at Rio Grande Regional. And when I saw him, I was like, fanboy. I was like, oh my God, this is the famous TikTok doctor. But, without further ado, here's the video.
Hey guys, don't scroll down. Listen a little bit. So I'm an interventional cardiologist and I live in McAllen, Texas. Here, COVID-19 cases were very low. There was a point in which I actually thought I overreacted. But my way of thinking is, it's rather to be safe than sorry. Now, lockdown in Texas was lifted in May 1st. People understood end of lockdown as end of coronavirus. Social distancing was not respected in many places. Masks were ignored, even considered dangerous by some people. And now, we're seeing the repercussions from that. For the last 9 days, record high admissions for COVID-19 all over Texas. Here in McAllen, hospitals are a little bit smaller. 10 days ago, we probably had in the hospital 3 cases. Today, we have 27 and 17 under investigation. It's not about the 1% mortality that people quote about COVID-19. It's about overwhelming the hospital. I'm not telling you to lock yourself down. I'm asking you to take precautions. Use a mask. Don't go to crowded places. At the end, it's all up to you.
And that is very true. And let me tell you a little bit of my experience in EMS and how it slowly developed for myself. And Cassie will share her version of the story in a minute here. So when COVID hit, we in EMS obviously started wearing a mask because we do follow the CDC guidelines. And hospitals weren't that busy, and this is a complete new virus, the coronavirus. I know people are going to say, well, there's COVID. There's been COVID before this, or there's been SARS before this. Yes, there's been SARS before this, COVID-19. But this is a new strain. This is all there is. It's a new strain that we've never seen before. So let's get the confusion out of the way. It's nothing that the government made or anything like that. No conspiracy theories here. Although we like to believe those things. But anyways, so this is a new virus. Nobody knew how to deal with it. Obviously, New York had a little bit of experience because they were the hotspot first. But here in the RGV, we were just going on about of what we knew, and we did what we could with what we know and what we have. And, it started very slow, and eventually it started developing to where the hospitals, as the doctor Assad mentioned here, the hospitals are very small here. And people say, well, let's take him to the hospital, right? But little by little, those cases skyrocketed to 1,000. And, we don't have enough beds for every patient. So some of these patients that weren't in respiratory distress, meaning that they're not having trouble breathing, they were sent home because they were not considered a severe case. They were treating those who needed to be sedated on a ventilator, and so on and so forth, you name it. And it started very slow, and eventually it turned out to where almost all the hospital was dedicated to COVID-19. There were areas in hospitals where it was dedicated for babies, for rehabilitation of elderly patients, and these patients had to be sent home or had to be taken care of elsewhere because there were not enough space, not enough beds to take care of everybody. And, people don't think about this. There's not enough beds. It got to the point where there were codes being worked in the hospital's bay. And what I mean by that is that, say, for example, my grandma gets a cardiac arrest, a heart attack. She goes into a heart attack and they rush her to the hospital. Well, when they get there, there's no beds because it's all COVID. So where do they have to work that cardiac arrest? They have to bring a team of respiratory therapists, nurses and doctors, and other personnel to the bay on an ambulance that it's no more than 3 feet wide by given 10 feet on a small ambulance, and they're working the codes out there in the heat when it's mid-COVID. It was crazy. I couldn't believe what my eyes were seeing. That's completely unprecedented. You never seen that, and that's what the age of COVID brought. That's what we saw.
I have no words. I just can't believe that it went to that extreme in the hospitals, but people were still, oh, COVID is a hoax. It's not real. Like, I'm still going to go out. Like, you can't, like, tell me that I can't go out. Like, it's my right. And it just plays into how ignorant people are. Because if it doesn't affect them, then it's fine. They're not affected by it. So, like, why would they put on a mask or why would they social distance if nothing has happened to them?
Correct. I think one of the big things was that it got politicized, the mask.
Oh my gosh.
A lot of people here have very crazy ideas, and I don't mean to down talk on the RGV, but there's a lot of people who get an education and at the same time they're very uneducated. And what I mean by that is that they'll be told, for instance, by the CDC, wear a mask, keep your social distance, try not to go out if you don't need to, you know. Mm-hmm. But here are people who started politicizing the mask that, you know, well, I'm not a sheep, or, oh, you can't tell me what to do. It's my right to choose not to wear a mask. Absolutely. Nobody's telling you that it's not your right. But it's for your protection of yourself and others, you know?
And not only that, it's mandatory out of like federal government, state government, any facility that you walk into, you have to wear the mask. Masks are mandatory right now. Absolutely.
And it was very difficult for police to enforce that. You know, people didn't seem to understand, oh, it's just another flu. And right. It's not. It's just definitely not a flu. It got to the point where in EMS, we were transporting COVID patients 24/7, you know. The medics, we work 24-hour shifts. So say, for example, tomorrow I'll go out at 5 a.m. and I don't get out till the next day at 5 a.m. So it's a whole 24-hour shift. And then during a normal work week, we'll get around 10 calls, give or take. You know, and you get some rest in between when you can. But when COVID hit, you were just not sleeping. You would get 10 plus calls and you would be completely exhausted, drained. You would get home and you didn't want to know about anything, you know, just completely crashed. And we were so exposed to COVID. We taken our precautions, put on the whole suit. And even then, at that point, I contracted COVID. You know, I came down with the COVID around, when was it?
The beginning of July.
Beginning of July. I think it was around July 6th that I went ahead and got COVID tested, came out positive. And at this time, Cass and I were living in Edinburgh.
Yes. And at that time, that day that you came home and you were feeling symptomatic, we were supposed to go home to my home, to Roma, with my family. Because my whole family was together at the time. Even like my cousins who are up north with their husbands in the oil field. So I was very excited for that. When you came home and you started telling me like, oh, like it's because I'm feeling sick, like I feel fatigue and I have a shortness of breath. And I was like, oh, well, like it's fine. Like you're fine. Let's just go. And you're like, no, like let's not go. Like what if it is? I'm like, yeah, I guess like you're right. And honestly, like I was sad that we weren't able to go, but getting the call the next day saying that you were exposed to a COVID patient, I was very thankful that we decided not to go.
Correct. And I was very in the fence about this because, like I said, this is all of this is new to all of us. And I was like, I don't know, am I feeling right? Am I feeling wrong? And I started with a sore throat, a very mild sore throat. And I thought it was going to go away, but it didn't. And the day before that, yes, I had work at cardiac arrest, where the patient came out positive with COVID. I didn't know at the time, but I did get that call the day after. And I was planning on calling back to my employer and tell them, hey guys, I don't feel okay. I'm feeling symptoms, right? And, you know, luckily we didn't expose our family, immediate family. My family actually was not in the country at that time. They were over in Mexico.
Yeah.
So we go get tested. And mind you, this is a 1-bedroom apartment. You know, Cass and I share the same bed, the whole thing. But the funny thing is that she tested negative twice.
Yep.
And this whole time we're quarantining ourselves. You know, we're not going out. If we need to get groceries, we'll call someone, right? A family member.
Yeah, my brother played a huge part in delivering us groceries, as well as your brothers as well.
Thank you, guys.
Absolutely. Shout out to y'all. Thanks.
It was very difficult, you know, because we were like, well, what do we do now? What if... And at this point, you know, the gears start turning inside your head. You're like, what if I do get to have, like, breathing problems that I can't breathe or things of that nature? Luckily, it never got to that point. It just got to where mild fever, just tired all the time, headache.
You lost your sense of taste and smell.
That is so true. The second week, I just couldn't smell anything or taste anything for some reason.
And this is crazy, guys. Like, I was making like some crazy spicy food, and he was like, I don't taste anything. And I'm like over here crying and sweating, and he was just like, okay, I guess.
Definitely. And it sucks because people ask me, well, do you still get hungry? Yes, you still get hungry. You just can't taste anything. It could be like strong black coffee and you just drink it like it was water, you know? So that happened. Definitely an experience and an eye-opener. Okay, so now we're going to show you a video from CBS Evening News. And just to get you an insight of what was going on in the hospitals. And I can confirm that this is more or less what it was like, you know. This is what we see day in and day out.
We want to go back now to Texas, where the governor previously warned that a 10% rate of positive tests would be a red flag for the state. Well, tonight we've learned that rate there is even higher, and that's being felt in the state's hospitals. CBS's Mireya Villarreal gives us an exclusive look from the front lines.
This is the sobering scene inside the COVID ICU at South Texas Health System Hospital in McAllen. Almost every patient in here is on a ventilator, and their chance of beating the virus is slim. Respiratory. Medical staff here are strained, struggling to treat more than 140 COVID patients, the highest they've had since the start of the pandemic.
There are so many patients coming in right now that there's just not enough beds for them.
Pretty much, yeah.
Dr. Osman Khan works in the ER.
Knowing how quickly things have progressed here, are you worried?
Yeah, I'm worried, and I feel that this is just the beginning for us. It seems like it's going to be getting a lot worse.
While we were there, Dr. Khan was treating Juana Prieto, who's developed pneumonia on top of coronavirus. Prieto and her husband Jesus were hospitalized after losing their 35-year-old daughter Jessica to COVID last week.
For those people that don't understand what this virus is, tell me, what has this done to your family?
There's no words I can describe this. Losing your kid, my only daughter.
Cases here in the Rio Grande Valley have increased by 70% over the last 2 weeks. And if you take a look behind me, you'll see some white windows. Those are rooms with COVID patients inside that have been retrofitted with special air filters. Right now, hospital administrators are telling me they are at critical capacity and they are begging for help before this gets out of hand. Nora?
All right, Mireya Villarreal, who just a few hours ago with her crew took all that protective equipment off. Thank you for your report.
Yeah, that was a very common thing that happened here in the RGV. And you know what doesn't help a lot? Doesn't help at all either is that a lot of our population is overweight. They have high blood pressure, diabetes, and those are things that don't help your case of COVID at all.
Absolutely. Oh, I'm sorry. Seeing that video got me a little choked up.
Yeah, and that's the sad part. You know, our community is hurting. There's lives that have been lost. As you heard, this lady, you know, she lost her daughter, her only daughter, and then she came down with COVID, and you know, that's devastating, you know, losing your only child. But that's not all. I mean, on top of that, you know, every hospital dealt with it a little different. And I think we're going to show another video here and this is very controversial. We can't confirm or deny, but we're just going on about what went viral just a while back. And this is DHR, a testimony from a traveling nurse. So this is what happened. When COVID hit, and as you heard right now, they were asking for help, a lot of help, because they were at capacity, you know, people having to work double shift. and you get exhausted. You know, you don't have the time to process one death after the other and having to break it to the family. But eventually, the traveling nurses came down, and here's a testimony from one of them of what they saw here in the hospitals here at DHR. And this comes from Vice News, and we're just going to play from her testimony point of view.
I went to New York. The patients were much sicker in New York. Here, they're just not being managed properly. New York obviously had one of the worst at the start of this, and that was bad because nobody knew what to do. New York did as best as they could, and they came around, and they're doing very good now in how they're handling it. And it seems like Texas is using literally nothing that was discovered during those earlier phases. I followed the young lady who posted the viral material, and I saw it actually while sitting in the orientation for the facility, and it seems preposterous. But upon entering the facility, I realized what she was saying, like, this is not a hospital. 104 patients lined in the hallway, and there's not enough room for half of that. There were patients in the gyms with curtains strung up between them, and the gyms were hot. They were like 90 degrees. They are killing people by not putting them in that hospital. I am confident in saying that. We do not have the resources. We run out of stuff all the time. There's not enough oxygen supply for all the patients. Almost every COVID patient needs some sort of oxygen. They have these big green oxygen tanks standing in the hallway in between patients' beds that don't have an alarm on them when they run out. You know they ran out when your patient's oxygen saturations are dropping, when they cold, or if the one person in the entire building that's checking on them notices that it's empty. It's not right at all. When we came in, was told that we had to work 24 with no relief. Nurses should not work past 16 hours because we're taking care of people's lives. We were told, this is emergency disaster relief. You need to be flexible. I watched a man, he's 30-something years old. We asked, he's not going to last long on this bypass. He needs to be intubated. He's okay. Just give him something to help him relax. The man quoted and died the next day. No matter how much we scream at the top of our lungs, nobody's listening to us. It's not safe. I feel for these patients. I really do. But I can't stay here. I can't risk my license. I have to go.
Okay, so that's what happened according to what was reported by Vice News, and it was in collaboration with a traveling nurse. You know, very, very shocking news. You know, what can I say? So I wanted to continue telling you the second part of when Cass and I were during COVID and quarantine. Another thing that happened is that we tested twice, and I tested positive twice, 1 week apart. And
I tested, I believe it was about a week after your first test. That was when the National Guard actually came to Edinburgh and did that massive drive-through testing. So I went on the first day of that. I got my results 3 days later, and it was negative, even though I was feeling a little symptomatic, but I don't know. I do think that I was just having a really bad allergic, like my sinuses, just because I am very prone to sinuses. And then the last day of that, I believe it was a Friday, me and Dell went again. And we both got tested, and he came out positive again, and I got my results as negative.
So that's something very strange that we can't explain ourselves. How did she tested negative twice and I tested positive twice? We're in this one-bedroom apartment, in close space. Like, we are shoulder to shoulder at this point,
Absolutely. The thing is that we were not social distancing at all.
I mean, where was I going to sleep? I wasn't going to send her to the couch.
No, he was going to sleep on the couch.
Well, she wanted to send me to the couch and keep the bed to herself. But, like, in all seriousness, even as funny as it is, we had no room to say, hey, we're going to put me in isolation and I'm not going to come out of here so you won't get contagion. There was like, at that point, we were like, okay, well, we get it. We get it. But
Yeah, like I was fully like as soon as like we got back that positive test, since Dale, the first time he took it, he did the rapid testing. And as soon as the lady came back and she was like, well, you're positive, you have to quarantine for 2 weeks. If you're feeling like you can't breathe, go to the hospital. Bye. No other instructions but that. And I was like, well, fuck.
yeah, so in other words, we had to do a little bit of our own research on what to do next and, what to look out for, basically. And at this point, I think when the whole National Guard came down because the RGV was considered to be a hotspot.
Absolutely. And it was a hotspot.
It was a hotspot.
They were doing, I believe it was over 5,000 testing per day. And they were here for a whole week. They were only supposed to be here for, I think it was like 5 days. And then they extended it.
Yeah, to 2 weeks or so.
Mm-hmm.
They ended up closing down the borders as well because a lot of people are coming back and forth. And believe it or not, a lot of Mexican individuals, a lot of Mexican nationals were seeking medical attention in the United States.
Oh, really?
Yes, because they, believe it or not, they don't trust their hospital systems over there. And, I believe they have more trust over here. So a lot of Mexican nationals were being brought over here with COVID symptoms. So that was another overload of the hospitals. Very, very small numbers, but those small numbers add up,
Absolutely. And like the hospitals we have right now, they're a handful, but they're not equipped to take over the amount of cases that we were receiving.
Yeah, most definitely. And while this whole thing is happening, just think that for a second we reach our 1,000 cases right around, what was it?
The 1,000 cases,
May 14, May 14. It was just crazy. And as of right now, sort of like to tie it all together, we still dealing with COVID, and
we currently are not considered a hotspot anymore.
That's a good thing.
Absolutely. And hopefully we're able to keep our numbers down. But if the bars open up again,
which they are, and we'll
technically
they are, and we'll touch on that in a minute.
Bars are not supposed to be open right now. So the way that most of these bars here in the valley are operating is that you have to buy food in order to stay there and drink.
That's correct. And I don't know how many of y'all listeners are aware, but El Paso right now is currently experiencing COVID-19 outbreak, and they're sending traveling nurses that way, just like we were in the RGV during May. And a lot of other places, I'm not sure when, but I believe a couple of days ago, whether it was within this week or last week, the United States hit its biggest second day of positive cases all around the country. And that's shocking because we are coming down and out of nowhere, boom, we're back up again.
Yeah.
And that's worrisome because we know that eventually will trickle down to the RGV because people, are hard-headed and they hardly like to listen.
But that's the thing. COVID-19 became so politicized.
I think politicized. It became very politicized, and it's a global pandemic. It's not a matter of red or blue. It's life or death.
Absolutely, and these people don't understand that. They're like, "Oh, well, like my freedom is being threatened," and oh.
Yeah, it's preposterous. It's not a, my brain hurts trying to make sense of how these people think that their fragile livelihood is being threatened by a simple mask, Okay, so as of October 5th, the USA it's curling in its third wave of COVID-19. Yes, the third wave. So we had the first one, the second one, and now we're going up again. And that's what we're talking about. We're very worried about what's going to happen.
And that's the thing. Here in the Valley, we're just getting out of our first wave. That's very terrifying right now. The United States is in its third wave. The U.S. in the country is in its third wave. The valley is barely getting out of the first wave.
My goodness. Okay, so we're going to show you something here. And look, what we're going to show you, it's a little bit of what's going on right now in the RGB, in the bars downtown. And that's basically our hotspot. Now, young people, we are prone to not listening to guidelines. But, as myself, as a homebody, it's easy for me to say not to go out, not to, socialize, this and that. I love socializing with my friends, but we're in a global pandemic. It's nothing to be taken, lightly. But just take a look of what's going on here in the RGB. And this is because Halloween was just
last night.
So
as of today, it is November 1st.
Okay. So we don't know when you guys are going to be seeing this, but this is just a glimpse of what's going on in the bars downtown. And that is just some of the, just like a small glimpse of what's going on out there right now. People are just not giving a damn, they just don't give a fuck.
They don't. And that's the thing. Like you go into Snap Map and you see downtown 17th
Literally,
Street.
You can go into your Snap right now and just go to the red hotspot and just click and you'll be able to see all these people gathering together.
Not a mask in sight.
That is very worrisome.
It is.
Especially because we don't want the same thing to happen at the beginning when we knew about COVID-19. People were aware of it. They knew what to do. They knew what not to do. And yet they were out there during spring break,
Oh, yeah. Because that's not how masks work, right?
Because...
Yeah. No, that's not how masks work. No, you're confused.
You need to touch your face.
It's by you touching your face.
You need to touch your face.
You can't breathe it in.
So, as of right now, there's so many good news. When we go to the hospitals as medics, we see how it's definitely has changed a lot. There's not a lot of COVID patients. And the remaining ones that we have, they're a small number. They're a small percentage. And we hope that it stays that way. But... what you just saw, it can either go either way. Either people take it serious or not. We can see a spike in cases again. And to be frankly, I want it to be over. I'm not telling you not to go out or to enjoy yourself or just wear a mask, keep your social distance because it's very important. We all want to go back to normal, especially since here in the RGB, we have a fragile economy. And we already talk about that, how we're considered to be a low-income area. So we want to close by showing you one last video. If you really still haven't gotten the picture of what COVID-19 does here in the RGB. And this is just a testimony of one of the doctors here in the RGB about a patient who is her neighbor.
Yes. He grew up with her in the neighborhood, and she was always one to take care of everyone, and she was one of the healthiest people that he knew.
Yeah, and for her age, of course. So, we're just gonna let this play here, and
Consuela de la Cruz is a woman who you had care of. She was not just a patient, though. She was a neighbor and a family friend through your mom. And you wound up against this reality of where people are forced to die alone in the hospital. And what is that like for you? What is the hardest part emotionally, Doc, in dealing with someone that you know who's forced to be alone? You had her son make a video for her, right?
That is correct. As you say, you can have the deepest respect for a person. That doesn't necessarily. That being said, you're right. I've lived in this community since 1965. The pictures that you are showing is of Consuelo de la Cruz. This is an 82-year-old female that was my patient. She was my neighbor. This is one of my mother's best friends. It's very common that our patients, even though we're a very large population now, 1.2 million, we all grew up together. This woman was a pillar of our neighborhood. Every night she would do her 3 laps around our block with her cane and that hat that she's wearing in that photograph. She's an inspiration to all. While the rest of our parents were humbling about in canes, this woman was as fit as you can possibly be. And you see the family pictures there. They went to the beach a week after the 4th of July. They went to the beach and they were in their own place. They were away from most of the crowds. As you can see in the photograph, there's ample distancing. People were not symptomatic. Apparently the child, which is relatively unusual, the small child had the virus, unbeknownst to anyone. And majority of the family members, of course, have tested positive. Within 9 days, Ms. De La Cruz, unfortunately, passed away. And as you say, the dramatic part of this, if you can imagine, you're taking care of someone that you love, you've known forever. Her son calls you and says, "They've called me from the hospital and we believe she'll die." And then he sends a video that is a goodbye video telling her how much he respects her. He loves her. She's an inspiration. And when by the time I get to see her that day, she's died. She's gone away. And so as an honor to him and his wishes, what can you do except open up the body bag and show this poor woman her son's video saying goodbye to her? And so these are the experiences that we're living. The doctors that we work in the emergency department, 3 are hospitalized. The nurses that brought us in, I've been a doctor for 30 plus years. The nurses that brought us in, we're going to their funerals. It's not just strangers that we're treating. These are a member of our community. They're our friends.
That is true. These are members of our communities. It's no strangers. We're a small population, so we, all these people that we see, it's people that we see at the store. People that we interact with day in and day out. I mean, it's just sad. It's just sad to have to say goodbye to someone like that. And that's the heartbreaking part, It's one thing to see it in the news, and it feels very distant. We don't understand what that is like, especially young people. But when it comes to, what if it was one of your family members? What if it's your mom, your brother, your sister, your grandparents? And that's when it becomes personal. It's all jokes and giggles until it becomes personal. One of your family comes down, and God willing, it doesn't happen to none of y'all. But if it does, that's when it feels very real. And, unfortunately, a lot of families have to say goodbyes, and not the way that they want to. They have to wait till the body is, in the casket.
Right. Like a bunch of these people are passing away by themselves, surrounded by machines, surrounded by nurses who they don't really know. They haven't gotten a chance to talk to them, because how do you talk to someone who is intubated?
True. They don't have their immediate family at their bedside. That's how we all grew up picturing that in our last breaths or last moments we can have our family by our sides. But the reality is that, as you heard Dr. Melendez say here, a lot of these families are dying by themselves, and that's sad. That's what we don't want to see here in the RGB, and that's more or less to give you a picture of what's going on here in the RGB. And I don't want to make it very sad here, but that's the reality that we've seen here. Anyways, guys, we're gonna end it here. Thank you for tuning in to the Life Physics podcast with Cass.
Thanks, guys. Sorry, I got a little emotional at the end.
But it's very emotional. You can't just help it. It's not emotional.
But the thing is, you have to expose yourselves to these things, because how else are you going to know?
Of course. And I know everybody's tired of hearing COVID, but it's a reality. The sooner we face our fears and our reality, the sooner we'll make peace with it and move on to the next thing. But anyways, guys, I know last time I said that we were on Spotify. Last time I said that we were on iTunes, on Apple Podcasts. We're not there yet. We're working on that. But we already have a YouTube channel, an Instagram, Twitter, and an email. So if you guys want to send us your suggestions, comments, or whatever the case might be, all the handles are going to be at the 956 Podcast on YouTube, Instagram, Twitter, and our email is going to be the 956podcast@gmail.com. Anyways, share your podcast with your friends and family, everyone in between. You can find us on Spotify, Google Podcasts, Breaker, Pocket Podcasts, and Radio Public. My goodness, that took a while.
All right, guys. We'll see you next week. Bye.